Mm, Good evening, everyone. My today's topic of discussion is swine fever in pigs. Classical swine fever in pigs. It is also known as swine fever, classical swine fever, hog cholera. Uh, Basically, uh, in pig diseases, in earlier days, in earlier years, the history, according to history of pig diseases, all these diseases are not very common in India. Mm, when this disease came in India, at that time the farmers are not aware of the clinical signs and also not aware of the treatment, or either they do not inform the authorities or the veterinarians about the disease. So this disease became pan Indian, and but nowadays the vaccine, the quality and quantity of vaccine is sufficient, and a good quality vaccine is made in India, and farmers are also aware about the precautions and clinical signs and what to do if there is disease. But now in almost all over India, the classical swine fever is very prevalent. What are the clinical signs of this disease? The basically it is a viral disease, and the clinical signs are uh, high fever, as the name indicate, high fever, and due to high fever there is low platelet count, that is thrombocytopenia, and because of thrombocytopenia there is oozing of blood under the skin, and due to that oozing there is purple hemorrhagic patches on the extremities of the body, like tips of the ears, snout, tail and hooves, and on the legs, and some spots on the belly also. As the name hog cholera, the clinical sign of cholera like vomition, diarrhea and fever is also there. And there is the incubation period, about incubation period, um, in 10 to in 7 to 10 days there is the animals survive or die within this week period. There is loss of condition. Another sign is anorexia, and most important, which causes a huge loss to farmer, is abortions. And now, what are the post-mortem lesion? Post-mortem lesions are the hemorrhagic patches, petechial hemorrhages on urinary bladder, on kidney, on urinary bladder, on kidney, and on spleen, and there is hemorrhages in intercostal spaces, and the button ulcer on ileocecal junction. These are few most common clinical post-mortem lesions of swine fever. And now, what is, if there is disease, what we have to do? First of all, according to the clinical sign, we are to treat symptomatically. Like if there is fever, we are to give this anti-febrile drugs like antipyretic drugs. Then we are to give this some antibiotic to prevent the secondary bacterial infection. Because it's a viral disease, there is no treatment of the viral disease. We are to treat symptomatically. And secondly, we are to give this some iron preparations, because there is loss of blood due to hemorrhages, and this is sufficient. And next, what we are to do to prevent the spread of disease. If there is disease in a herd, in a farm, then what we are to do, or what we are to advise to the farmers, is to follow, first of all, the separation of the litter or separation of the pigs, affected pigs, from the healthy pigs. Then separation of entire labor, the labor which are to take care of healthy animals is separate, and the labor which is to take care of sick animal is separate. All farm facilities like water pipes, then all feeders, all feeding trolleys, then the gumboots, etc., are separate. And another most important is to follow, these are all under biosecurity, and following biosecurity, we are to take care of the movement of the animal. Do not move sick animals to other places, do not sell the sick animals. And another thing is, what we are to do for prevention of this disease. As swine fever is viral disease, we are to prevent this disease by doing vaccination. Vaccination of first in India there is leponized vaccination, and now which is prepared from rabbits, and now there is a tissue culture vaccine. It is prepared in many places, like at IVRI Bareilly, then Calcutta, then Hisar, and in Punjab this Punjab vaccine BP section, biological product vaccine institute, BP section, Ludhiana, in PAU. And the vaccine is dried in dried form, and the doses, I think 50 doses vial, and they give you they give you this diluent also, and you are to, the procedure is you are to take this vaccine and maintain the vaccine quality by following a strict cold chain. Then mix the dry vaccine with this diluent and inject 1 ml dose, 1 ml of dose subcutaneously. And first age at first vaccination is immediately after farrowing, immediately after weaning. Approximately in Punjab or in Haryana, the farmers separate the piglet from mother at the age of 40 days, or at the age of at the age of 2 months. And before vaccination, we are just to deworm the piglets. That is, if there is any worm load, we are to minimize that worm load, because it causes stress, and we are to minimize this stress of worms, and vaccinate the animal subcutaneously. And the best site of giving this vaccine is like in the neck portion, because in the neck portion there is less fat, and there is, we can hold a fold of skin. And another point, from where the hind leg joins the abdomen, that triangle part, a loose skin is there. There we can give subcutaneously. And another method, that the vaccine deposit only under the skin, that is under the subcutaneous part, is use a short length needles. Short length needles, they directly goes under the, that crosses the skin, and that strictly deposit, accurately deposit under the skin. If the vaccine is deposited under the skin, there is a light vesicle formation, like a raised portion, there, indicating the vaccine is deposited under the skin. And the vaccine is actually, this vaccination, swine fever vaccination, we do annually, but nowadays farmers are doing this vaccination after 7-8 months. They want to doubly sure that the animals are protected from this disease, swine fever. That's all about swine fever. We should follow this vaccination. 1 ml of dose, and repeat after 7 to 10 months, or if there is strict biosecurity, we are following biosecurity for properly, or there is no other there is no chances of infection from other animals, or from when we bought new animals, we keep them in separate pens, and all these conditions, when we follow all this, we are quite safe. That there is no disease, so we can repeat the vaccine after a year or 11 months. And vaccination is the only route, is the only method of saving our animals from swine fever. And swine fever in farmers are very panic when there is slight redness due to some allergic reaction. They thought there is swine fever. I receive many calls from farmers that there is redness on the eye, on the ears, redness on the body, but in simple, there is a difference in simple redness and in purple hemorrhagic patch. And because in purple hemorrhagic patch, one sign is very clear, there must be fever. There must be diarrhea, and this vomation, and these, first there is fever, followed by these, after 1 or 2 days there is purple patch. This purple patch is something else, and redness all over the body is something else. And we are to also to differentiate from circovirus. In case of circovirus, it is also a hemorrhagic disease. It is a viral disease, it is also a hemorrhagic disease, but in circovirus, the patches are of small size, and it is all over the body. all over the body. That's very small patches, very small dot, like a ball, circular or some irregular patches, not on the extremities but spread all over the body. If there is hemorrhages all over the body, then it is circovirus. If there is hemorrhages on the extremities, then it is swine fever. Extremities means on the outer side of the body, on the outer parts of the body, like ear tips, like snout, like tail, on above the pastern part, on the hind legs, and some patches on the abdomen also. First, do not panic. First, differentiate between which disease is it. It is simple redness, simple allergic signs, or simple allergy, redness due to some allergy, or it is swine fever, or it is circovirus. Then accordingly treat the animals. We all know prevention is better than cure. So, following this motto, always vaccinate your animals timely. Thank you. Thank you very much.